Hey everybody, and welcome once again to Time Out with Kevin Gallagher. I'm, of course, your host, and it's a real pleasure to have you here around the round table. And we're here every week, Friday nights, 8:30 p.m., Monday mornings at 11 a.m. And if you miss any of the shows, or you want to go and see a show again, a second time, you want to catch it, hey, we can have you go out to YouTube and you can watch the shows there. The last 14 and a half years or so worth of shows are up. There's over 800 videos that are up on YouTube right now for you to go and watch. That address is right there. See that right there? It's right there below my name, timeoutyoutube.com. Set up a special URL so that you can get out to it easily. You don't have to remember the long YouTube. Just go there, check it out. Also, new radio show. And that's on These Changing Times Radio, Tuesday nights, 8:30 p.m., 8 p.m. to 9 p.m. I'm used to saying 8:30 being here. And this week we're taking a look at the benefits of chiropractic. Did I say that right, Donna?
Chiropractic.
Chiropractic. Okay, see, I don't know. But I'm here with Dr. Donna Boylan. I've seen you around for years in Bethel. You have your office right in the downtown where I live. And, it dawned on me, 2 months ago, I haven't asked her to come on the program, and I should really have her on. So you're here.
Thank you so much for the invite. It's an honor.
You're very welcome. First of all, let people know a little bit about yourself personally, whatever you want them to know, and we'll get into the program.
Sure. Let's see. I have been a practicing chiropractor for 23 years, and I am excited about being a chiropractor. I'm very, very blessed because I get to work with people of all ages.
All ages.
All ages. Children, middle-aged, older people, seniors, and it is just so exciting. I have a wonderful team. We have a great atmosphere, which is a very warm and friendly environment.
That's great. How did you first get interested in becoming a chiropractor?
It is, for me, I've always had an interest in science. And I went through school being very active in sports. I grew up in a family with 6 kids. And basically you would come home from school and run outside and play. And I was very active in basketball and softball.
Okay.
And what was interesting for me is that when someone got injured, I wanted to go over. I was one of the first people over to try and help them. And I was like, okay, calm down. But I wanted to know more. I didn't know what to do. I didn't know how to evaluate the situation and what was the problem. And was it a tendon rupture? Was it just a strain? And I wanted to know more. And that stayed with me. And basically was going to college for pre-med.
So did you at that point have an interest, I would imagine, in, say, sports medicine?
I had an overall health vision. I wanted to understand what was happening to people if they had an injury, but also what was happening with people with the choices that they made. So I went to the State University of New York at Binghamton, and I was pre-med. And during the break between freshman and sophomore year, my uncle knew of my interest with sports and wellness and introduced me to one of his neighbors who was a chiropractor.
Okay.
And he arranged the meeting. We spoke for 3 hours, and that conversation changed the course of my life.
To what you're doing today.
You hit it on the head. That's right.
That's amazing. So, tell me what exactly does a chiropractor do?
A chiropractor.
I know we got 30 minutes.
I know. That's what I'm thinking. Yeah, I need an hour. What a chiropractor does is really connects with the patient. When you walk into the office, we really work on allowing each of these people to come in and know that they're in a safe and warm environment. What we do is we meet with each and every one of these people. I meet with them. I do a consultation to find out about their lifestyle, about who they are, what are they involved with, what brought them to the office. Are they there for a health and wellness visit, or are they visiting us because of some kind of symptom? And then from there, what we do is we do an evaluation of over 70 different tests. We also do a computerized nerve scan, which is a really cool technology and allows me to understand what's happening with the autonomic nerve system as well as the motor system, the motor nerve system. It'll let me know if there's acute injury or chronic injury, and if x-rays are warranted, we have that in our facility as well.
So when when I ask you a question that may sound kind of silly, but I think is a very legitimate question, what is the spine to a chiropractor?
What is the spine?
Yeah.
Well, the spine is a house.
A house.
The
I wouldn't have
spine-
thought of it as a house.
Yeah, you know, it's interesting. My question to you would be, what do you think a chiropractor is? Or do you think a chiropractor is more a bone doctor or a nerve doctor?
See, I would immediately think bone. I mean, we got this guy sitting here. You don't need to get a close-up or anything, but you know, when I think of a spine, I'm thinking of bones, but I realize that there are nerves inside of there, but that's not what I think of first.
I know, and that is my mission. That is my mission, is to allow our community to understand exactly the importance of that. So when you ask, well, what does the chiropractor work with? You know, the spine is just the house of the central nerve system. And the central nerve system, which is composed of the brain going down through the spinal cord and then coming out through the spinal nerve roots, that's really what we work on.
That's interesting. So what are the types of things that you would do on a daily basis with a patient that maybe the average person wouldn't imagine a chiropractor doing?
You know, I think most people will think that a chiropractor is a bone doctor, as you did. And what we do is on a regular visit, we are trying to figure out what happened with that patient between when I see them today and their last visit.
Got it.
Because one of the biggest encounters of all people in the planet is stress. And how that stress is affecting their body. We have physical stresses, we have emotional stresses, we have chemical stresses. Physical stresses from the way that we sit, to the way that we stand, to the way that we lift, to the way that we sleep, to the emotional stresses. The idea, you know, I've got to get over there within 20 minutes. To the idea of, okay, did I take care of everything? Did I pack the car? Did I talk to my family? Did I make sure everything was taken care for? The stress of what's happening with our economy. The stress of what's happening with war. You know, there's so many different things that bombard us. And then to chemical stresses. Are people drinking water? You know, or are they smoking cigarettes? Are they eating veggies, or are they eating processed foods?
Right.
And that all has an effect on our body. So what we do is the patient would come in as they've already had their evaluation and we've started care. Well, I'll be feeling their neck or their mid-back and their lower back to see what their body is saying to me. It's almost like I get to read their body.
And how is that actually done?
Well, what happens is that once a patient is under care, the patient will come in and we have a special table, which the adjusting table, that they'll come in and they'll lay down, and I know certain areas that are their stress zones, but I can feel, and I'll take time to actually feel each individual level from the base of the head, through the neck, through the mid-back, and through the lower back, and feel the supporting structure, the muscles, and see exactly what is happening. Where is their stress? Where is their tender points? Is there a rotation?
Interesting. So how did this whole science get its start?
You know, I love that question because chiropractic officially began in Davenport, Iowa in 1895. And what happened was a gentleman by the name of D.D. Palmer, who was a healer. He was in his building rather late, and the janitor came through. And this gentleman's name was Harvey Lillard. Now, Harvey Lillard was a gentleman who had been deaf for approximately 15 to 16 years. And it had ensued after a trauma. He had hit his head somewhere along the line. And Dee basically was sharing with him, you know, come over here, I want you to lay on this table. And Harvey went with it. And he laid down, and what Dee did was he felt along the spine, and he felt one of the bumps on the back of the vertebrae, which felt a little askew. So in this primitive way, he applied a thrust, and this gentleman got up, and he started to hear. Really? That is how chiropractic got its beginning.
And so he figured out that if I can do some way of moving the bones around, I know there's a special term for that because when I saw you at your office doing the prep work for this, I was like, no, it's called what?
The adjustment.
The adjustment.
The adjustment, yes.
And then there's another term, sublation, I believe it is?
Very close, the subluxation.
Okay. I wouldn't be able to say that 3 times fast.
It almost, sometimes you want to say submarine.
Yes, submarine.
But the subluxation...
But what is that?
Yeah, you know, the subluxation is the actual cause of what is the interference on that nerve system.
Which is why that gentleman wasn't hearing?
Exactly, which in this particular case, that interference showed up for Harvey as a break from his overall central nervous system out toward the ear. And by having that adjustment, it allowed the tympanic membrane and the little bones within that ear to work better and allowed him to hear.
Are there any connections into because at one time I went and I had some acupuncture done, and it blew me away because you figure, they're putting little needles in. Well, I had really bad back stress. The muscles are really tight. And I remember the lady went to put the needle in, and the needle literally went and bent like this because the muscle was so stressed. It literally went like that, and they went, "Ooh, look at that!" And then she was able to get the other one in, and she left them in there for like 10 or so minutes. And I'm thinking, what is this going to do? I mean, what I need is a back rub. And so we went and took them out, and because I was so stressed, there were little droplets of blood, and that's normal when you're that stressed. And I swear to God, I felt like somebody just worked my back over for 30 minutes. I was like, and the point I'm making is that she was able to use those needles to manipulate the nervous system. So are you doing anything like that when you're doing what you do?
What we are doing, and there's no blood.
Right. This was like so wild because
what we do is we find where the interference is, whether it's on the neck or the mid back or the lower back, and then we very safely and gently and effectively allow the bones to get back into better position. Because that subluxation is when these bones shift, and when the bones shift, it creates an imbalance. And it creates a lack of motion, which therefore will then transfer into irritation on that nerve system. And you have nerves all over your body. There are trillions of cells. It's just incredible the amount of nerves. When they say you have a lot of nerve, it's very true.
They mean it.
It's very true.
Well, yeah, because now you bring that up, all of your senses are being transferred by the nervous system.
Correct.
So if you feel like you smash your finger with a hammer, that's being transmitted via your nervous system.
There's tiny, tiny filaments. It's just incredible.
That's wild. So how do you define health?
It's interesting. That's one of my favorite questions to talk to patients about. We'll do new patient orientations every Monday evening. And how do you think most people define health?
To me, not being sick.
And that is what we hear.
Very simple way I can put it.
And that is exactly what we'll hear. And I can go on and on with stories of people who went and had an annual physical, and they had blood work done, and EKG, and urinary analysis, and chest x-ray, and everything came out great. Yet they left the doctor's office and had a heart attack in the parking lot. Okay, that was my grandfather.
Wow.
And in essence, health is not merely the absence of disease or infirmities. Health is a balance of physical, chemical, and emotional well-being.
Okay.
And when that is in balance, then it is when we're at optimal health.
Because I remember years ago somebody told me if you look at the word disease and you break it in half, it's dis-ease.
That's correct.
So
I love that.
Yeah.
Because dis-ease, the hyphenated dis-ease, means lack of harmony.
Right.
And when there's a lack of harmony, the body is struggling to get us back into balance, homeostasis. But if it can't, and the body is chronically stressed in terms of physical, chemical, or emotional, then it leads to disease.
Right. So how much does for you, two parts, you personally as a chiropractor and chiropractors in general, how much do you work with doctors in other fields? And what other fields may they be? And maybe there's some fields that maybe the person watching right now would go, I would never imagine a chiropractor would work with fill in the blank.
Absolutely. First of all, we have MDs and their families under care.
Okay.
Okay, so we work with neurologists, we work with orthopedists, we work with general physicians, we work with pediatricians, we work with OBGYNs, there's a whole podiatrist, a whole bunch. I mean, wherever people are having some kind of irritation, eventually we refer back and forth.
And so this would be generally done as a referral, like a doctor would say, oh, go see Dr. Boylan.
Correct.
It's very interesting. Is there a typical patient where that happens? Do you have a typical patient?
do I have a typical patient? I think we have ideal patients. I could tell you that the patients that tend to really make the decisions in the family is the women. So we will ideally we'll go and want to get information to women between the age of 28 to 55, because in the family setting, they're the ones that are going to say, okay, honey, you know what, this is a situation, you need to go to the chiropractor, I'm going to set up the appointment. Men
That's
generally
why
won't do that.
advertising is all aimed, for the most part, at women.
And healthcare, that's very true.
Yeah.
Yes.
And just in general, because, and it's probably changed a bit now, but as you look through society, the men went out and worked, earned all the money, and the wife said, okay, what do we do? And she manages the family. And she's the one that would go out during the day and buy the groceries, buy whatever needed to be done, and take care of the kids at home. That doesn't happen so much anymore, unfortunately, but that's generally how things would be done. All advertising, then, the vast majority was aimed at females, at women. You know, one thing that I learned over the years is that a doctor doesn't really heal people. What they do is they make the body able to heal itself. Would you agree with that statement?
There is no doubt. That's one of the basic tenets of chiropractic, is that what we're doing is we're working with the body. Literally, we're adjusting. The subluxation is where the cause of the irritation is on the nerve system. It's the adjustment which will allow that opening of the nerve system. It's the adjustment which will then allow that body to go and get at peak, to go and heal itself. So we're just tapping into the body's own healing capacity.
Right.
That's what each and every adjustment does.
Now, what I kind of imagine in my mind, and maybe tell me if I'm on the right track, is I kind of imagine what you're talking about with the spine, and we'll take Mr. Spine here, we'll put him up on the table. What I'm imagining is kind of like if you had an electrical wire and you crimped the wire and you stopped the electrical flow of energy.
Correct.
Is that basically what's happening here? Because that's what I picture in my mind.
Exactly. And what I did was, I love that you talked about the wire, because I brought a wire.
You brought a wire.
I brought a wire.
We didn't plan that
No,
either. We really
I knew. I said, you know what, Kevin's going to bring this out. So literally, as these nerves are coming out, it's just like the old telephone wires. You know, we live in a society where the technology is all wireless. And in the olden days, when you and I were growing up, there were wires, and if you were to cut the telephone wire in half, you would open it up and you'd see all these filaments.
Yes.
Now, if we take this nerve and we look at this cross-section, okay, so if we go like so, and we take that, we say that this is the nerve, and we open it up, and we look at all of these filaments, there's a whole bunch of different filaments, we'll call them, as part of the nerve. What percentage of these filaments do you think are for pain?
It's probably a trick question. How many?
What percentage? Just give me a gander.
2%.
Ooh, I'm so surprised, because the majority of patients will say 80%, 100%, and literally it's 15 to 20% of these fibers are for pain.
Okay.
So what do the remaining fibers actually do?
You tell me.
Oh, my dear, think of everything else. It's 2-point discrimination, so that if a bug lands on us, we feel it. Or if we go outside and it's 100 degrees, we start to sweat.
Yeah.
All right, so those nerves will go to the sebaceous glands, we'll start to sweat. If we want to move our arm, there's motor nerves, which enable us to move our arm.
Yes.
And there's so many other functions then for the nerves, and also for the capillaries to dilate. You know, or for nerves to go to the pancreas. So all these different things is what these nerves do.
Great. Why don't we start here at the top of Mr. Spine and work our way down and explain to people a bit about what they're looking at and exactly what you do when you're seeing them, you know, during a session.
Sure. Well, you know, it's interesting because all the way up in here, this is where the head is. This is the cranium. And your brain sits in that cranium, okay? The brain will come down to the brain stem right here and then go into the spinal cord. So right here, the brain goes into the brain stem, and now it's going through the neck, through the mid-back. There are 7 bones in the neck. There are 12 in the mid-back, and then 5 in the lumbar spine. Okay? These are discs which are in between. And what do you think the discs are there for?
For support.
Correct, for support and for mobility.
Yes.
Okay, they act as a cushion and they enable us to move. All right, so there are 24 movable vertebrae in the adult spine.
And there's 24 total?
24, yep.
Okay, so what are these little guys here in between each bone?
Right here in between these?
Yes.
Those are the discs.
Those are the discs?
Yeah.
And so when you say that you've slipped the disc, this is actually what has slipped?
Well, you know, it's very interesting because what I'll do is I'll show you this right here. This is, if you get a chance to zoom right in, it almost looks like a piece of bubble gum.
Yes.
And that would be, quote, the slip disc or a disc bulge. And what happens is that when people are losing flexibility, the disc can become dried out, or what we call desiccated, and this will enable little tears to happen. The best analogy I could give you is that this disc is very much like a jelly donut.
Okay.
And the cartilage surrounds the jelly, which would be the dough of the donut, and inside the donut would be the nucleus.
Got it.
And when that starts, when the dough or the cartilage starts to get tears, that's what will leak out, is that nucleus, the central portion of the disc. And if it goes up against the nerve root, that's when people will experience lots of problems in the back, if it's in the lower back, or it could go down the leg, depending on where that nerve root is going, because it's putting pressure on that nerve, and then wherever that nerve leads is where people will feel it.
Interesting. So anything else to add before I put Mr. Spine back, or?
You know what? Very much, a chiropractor is the electrician of the body.
That's an interesting way to put it.
Yeah.
I guess they're not kidding when they say the body electric, right?
Yes.
Right.
It's true.
Right. So, you know, what can people do to keep the spine healthy?
A whole bunch. Lots. There's a whole list here. First of all, what they can do is make sure that they exercise their body, and to do it regularly.
Okay.
Okay?
What type of exercise?
It can be simple. It doesn't have to be that they have to join a gym. Just walking, doing simple stretches for the neck and for the mid-back and for the lower back.
Yes.
You know, if they want to take it to the next step and join a local gym and work with a personal trainer, I think it's fantastic. What also people, then they can drink water. Water is so important. Our body is 60 to 70% water, and what water does is it enables the biochemistry of the body to work so much better. It enables the muscles to try and relax.
Now, you were covering something before, and it sparked a question off in my mind, and I got probably another 1,000 questions that we're not going to be able to get to, but you were talking about with the discs drying out.
Yes.
And along this same theme of the health, what can somebody do either with their diet or whatever to help change that if that's actually happened?
One of the best things, again, is exercise, and when those discs start to dry out, that's basically leading to degenerative change. Get to a chiropractor. Get to a chiropractor and get checked for subluxations. Because you see, arthritis does not have to be something that you get. We have people who are in their 60s who've been under chiropractic care for 40 years. Now keep in mind, I've only been a chiropractor for 23 years. So these are people who had chiropractic care even before I was in practice. But if we go and I remember this day vividly. I took x-rays of a gentleman who was 60 years old. He'd been under chiropractic care for 40 years. I took x-rays of his lower back, and the same day I took x-rays of an 18-year-old lower back. The 18-year-old's lower back views showed more degenerative change than the 60-year-olds.
Why would that be?
It's very simple, because each of these adjustments that gentleman received was literally added lubrication to the area of the spine that he needed. So if he had the subluxation or a joint irritation at the base of the back, by getting that freed up, it was like oiling the joint. It was motion, which then allowed fluidity of motion above, through the neck, through the mid-back, and through the lower back.
It's pretty wild. I have a few minutes left.
Okay.
Is there anything that I haven't covered with you during the program that you want to get out on the air right now?
Oh my goodness. I mean, I could go on and on. I think one of the biggest things I would want people to think about is this. People go for an annual physical, and they'll visit, and they'll get the EKG, they'll get the chest x-ray, and they'll get blood work and urinary analysis. And that's great. They get a baseline. And people will go to the dentist maybe once or twice a year, but what does the dentist check?
The teeth.
Okay, the teeth and the gums. Do you ever go to your MD to get your teeth checked? And do you ever go to the dentist to get your heart and lungs checked?
No.
Okay, so our specialty is checking the nerve system and the cohesiveness of how the body, how the neck, how the mid-back, and how the lower back is working. Yet, how often are you getting that nerve system checked?
Yeah.
That is key, and that's what our specialty is.
Now, aside from this, with the world we live in and the way the medical system is now, is this something that's normally covered under a person's insurance?
Yes, and again, if I were to print up a list of how many insurance companies we work with, there's over 1,600 insurance companies on our list.
So that shouldn't be a problem for somebody thinking, oh, you know, whether it's you or another chiropractor, I really might want to go do that, but I wonder if it's covered by, you know, fill in the blank.
You know, it's interesting. We're finding more and more, even with people's insurance, let's say if there's a copay, we see more and more copays at $45, $55. I'll tell you right now, our office visit is comparable. So chiropractic is very cost effective and affordable.
That's neat. And let's see. What would you say? I got a minute left, and I want to keep going. How do you like that? 1 minute, Donna. We got to have you back on again.
I would love it.
You want to come back?
Absolutely.
We'll have you back.
I've got your back.
You got my back? Oh God! Hey, Dr. Donna Boylan, kids, and she's funny too. So hey, I'm Kevin Gallagher. I want to thank you so much for joining me here on the program tonight. Thank you for coming in. For Dr. Donna Boylan, I'm Kevin Gallagher. Please tune in again next week to see what it is we'll be talking about. Until then, have a great night.